Good afternoon, everybody. Welcome to the Tunisian Society of Cardiology stand from Madrid. It's my pleasure to introduce Professor Gianluigi Savares, professor in cardiology in Karolinska Institute in Stockholm. He's an eminent expert in heart failure. He's also the General Secretary of HFA, Heart Failure Association of the European Society of Cardiology. I'm very delighted to have you with us in the stand this afternoon. Thank you for accepting our invitation. Certainly, Dr. Gianluigi, there are many news with the trials dealing with the treatment of heart failure, SGLT2 inhibitor, vericiguat, and the old treatment of heart failure. So this morning, the results of DAPA Act, Victor, and Digit Heart Failure were presented. There were a lot of tragedies in the main arena. So what are news in this meeting?
Thank you so much. It's a pleasure to be with you and to be with the Tunisian Society of Cardiology. It's always a pleasure to accept your invitation. So this Congress is very rich of new trial, I will say, together also with many sessions focusing on implementation. Of course, if we have new trial, then it's key to push them for the finding forward into clinical practice. So let's start with the DIGIT-HF trial. So here we have a quite sick population of patients with heart failure with reduced ejection fraction, and the treatment which was tested against placebo was digitoxin, and it was of course tested on top of usual care. So basically we have a contemporary population treated according to a contemporary care, and the results were great. Actually, digitoxin as compared to placebo reduced the primary outcome of the trial, which was a composite of cardiovascular mortality or heart failure hospitalization. So what comes next in terms of digitoxin? Well, I don't think it might be the fifth pillar. I rather think that probably this should be a treatment aiming to target more severe heart failure patients. Yeah.
So digoxin is not dead.
No,
it's still alive.
In a different form, but it came back. I definitely agree with you. And then another key trial, which was actually presented today, was the DAPA Act trial, and this trial actually target a quite severe population, patients hospitalized for heart failure, and the treatment which was tested was dapagliflozin as compared to placebo in patients hospitalized for heart failure after, let's say, reaching hemodynamical stability. And the trial had a very short follow-up, and overall was neutral, so there was no significant reduction in risk of cardiovascular mortality or heart failure hospitalization, although the hazard ratio was definitely below 1, so kind of showing interesting trends toward potential reduction of outcomes. Together with the presentation of the trial, also a meta-analysis was presented pooling data of this trial together with the Soloist and together with the MPulse trial.
With empagliflozin.
Yeah. So that was very interesting also because it was possible to show that whether all these trials were pooled, actually SGLT inhibitors do reduce the risk of cardiovascular mortality or heart failure hospitalization when they are initiated during an hospitalization for heart failure.
So earlier is better?
Definitely,
we have a good hemodynamic status.
Yeah, it's key.
Inhibitor.
Exactly. So I think this has huge impact on the implementation of these therapies that we already know work in patients with heart failure. So this is not a novel finding, but now we have more information regarding the timing of initiation. And then we go to the Victor trial. The Victor trial, as you anticipated, Leila, on vericiguat as compared to placebo. It comes after the Victoria trial, which was targeting a population with FREF and worsening heart failure episode, right? So it was a quite sick population. And now we have a different population tested for vericiguat as compared to placebo, which are more stable chronic heart failure patients. So the trial overall was neutral, so there was no statistically significant reduction in cardiovascular mortality or heart failure hospitalization with vericiguat as compared to placebo, but there was a statistically significant reduction of the risk of all-cause mortality and cardiovascular mortality. And these challenging results, right? But I think it's quite important to report also that in exploratory analysis, they enriched the composite outcome also of outpatient episode of worsening heart failure, so IV diuretic use, up-titration of diuretics, and whether that was considered as an outcome, that would have been a statistically significant reduction of that outcome. So probably we are just changing care, so we don't hospitalize patients so much anymore, but we rather have an outpatient and management of heart failure. And this is trial evidence which has been presented together with many other sessions in the heart failure field about cardiorenal metabolic disease, so obesity, cardiorenal syndrome, a lot of, I think, in discussion on implementation. So I think we will bring back to Tunisia a lot of good results.
It's usually a pleasure to have you in Tunisia. Thank you, Professor Savares, for this nice news results presented directly from Madrid. It's our pleasure to have you with us. I'm very delighted and honored. And thank you for accepting again our invitation.
Thank you so much.
Seeing you in Tunisia. And you have our meeting in November. Yeah. And we will be with you in the meeting of Heart Failure Association. It will be in Barcelona in May 2026.
Exactly.
Okay, thank you.
Thank you so much. Have a nice day.